The roof of the olfactory region is formed by cribriform plate of ethmoid. Ipsilateral deviation of tongue is due to unaltered action of genioglossus. Dorello's canal transmit in tip of temporal bone to en route to cavernous sinus abducent nerve. First branch of facial nerve is greater superficial petrosal nerve. Branchial sinus passes between two carotids. Following are the temporomandibular joint ligament except tympanomandibular. So the temporomandibular joint ligaments are stylomandibular, temporomandibular and sphenomandibular. Superior rectus is supplied by which cranial nerve? Superior division of third nerve. Anatomical site of origin of stridor is larynx, bronchus and trachea. Structures passing through superior orbital fissure is oculomotor nerve, trochlear nerve, lacrimal nerve, nasociliary nerve and abducent nerve. Which of the following statement is true regarding the pituitary gland? It is situated deep in the cilia. The sphenoidal air cell life inferior to it. It is supplied by a branch of the internal carotid artery. The recurrent laryngeal nerve supplies vocalis muscle and posterior cricoarytenoid muscle. Which of the following are draining channels of cavernous sinus? Inferior petrosal sinus and superior ophthalmic vein. Recurrent laryngeal nerve has the following course and neck. It passes anterior to inferior thyroid artery. It passes between branches of inferior thyroid vessels. It passes posterior to inferior thyroid vessels. Structure that passes through the internal auditory canal is nerve of Resberg, superior vestibular nerve and cochlear nerve. Nasal septum is formed by crest of maxilla, septal cartilage, perpendicular plate of ethmoid and nasal bone. Inferior thyroid artery is a branch of thyrocervical trunk. True about tonsils are lymph node drain to jugulo-digastric node. It is endodermal derivative. Rest on superior constrictor of the pharynx. The mastoid antrum is related to the following nuclei in the thalamus, cochlea. How many lymph nodes are there in cervical group? 100. Thyroglossal cyst moves with deglutition because attached to hyoid bone. All of the following are grouped together as muscles of mastication except buccinator. So the muscles of mastication are masseter, temporalis and pterygoid. Function of stria vascularis is none of these. Muscle not arising from oblique line of thyroid is cricothyroid and cricoarytenoid. Internal carotid nerve is a branch of internal sympathetic chain. Sphenopalatine ganglion is formed by superficial petrosal greater. Glossopharyngeal nerve gives tympanic nerve, pharyngeal plexus and tonsillar branches. Which of the following is not supplied by ansa cervicalis? Thyrohyoid is not supplied by ansa cervicalis. Sternothyroid, sternohyoid and omohyoid are supplied by ansa cervicalis. Which is not found on the lateral wall of the nose? Lamina papaeoisis. So what is found on lateral wall of nose? Infundibulum, superior concha and bulla ethmoidalis. Vertebra prominence is C7. The following are supplied by 12th cranial nerve except palatoglossus. So genioglossus, hypoglossus is supplied by 12th cranial nerve. All are supplied by cervical plexus except mylohyoid. So what is supplied by cervical plexus? Geniohyoid, scalenius medius and capacius longus. A patient presented with normal eyesight and absence of direct and consensual light reflexes. Which of the following cranial nerves is suspected to be lesioned? Oculomotor. All are elevator of larynx except sternohyoid. So all what are the elevator of larynx? Thyrohyoid, digastric and stylohyoid. All are supplied by chorda tympani except posterior one third of tongue and muscles of facial expression. So what is supplied by chorda tympani? Anterior 2/3 of tongue and secretomotor fibers to submandibular gland. Posterior belly of digastric is supplied by facial nerve. Supraorbital and supratrochlear arteries are branches of which of the following? Ophthalmic artery. Ascending pharyngeal artery is a branch of external carotid artery. Kazignac tubercle lies at level of Erb's point. Foramen of Monro connects lateral ventricle to the third ventricle. Tensor tympani is supplied by mandibular branch of fifth nerve. Most important muscle which opens mouth is lateral pterygoid. All of the following arise from apex of orbit except superior oblique. So which muscles arise from apex of orbit? Inferior rectus, superior rectus and medial rectus. Which one of the following is correct regarding superior thyroid artery? It arises from external carotid artery. Following muscles are supplied by facial nerve except masseter. So which muscles are supplied by facial nerve? Stapedius, anterior belly of digastric and occipitofrontalis. Which of the following passes between base of the skull and superior constrictor muscle? Eustachian tube, levator palatine muscle and ascending palatine artery. Abduction supplies lateral rectus. Which of these is not a tributary of cavernous sinus? Superior petrosal sinus. The following muscle is an opener of the glottis, posterior cricoarytenoid. A patient complains of persistent numbness of the chin, lower lip and lower teeth. She further indicates that she has difficulty chewing. Radiographic studies of the head demonstrate a small discrete mass in the infratemporal fossa, which nerve has been compressed by the mass? Inferior alveolar nerve. Structures which pass through the superior orbital fissure is all except central retinal artery and optic nerve. So which structure pass through the superior orbital fissure? Lacrimal nerve and superior ophthalmic vein. Cranial nerve related to apex of the petrous temporal bone is 6th and 5th. Which one of the following structure passes through sinus of Morgagni, ascending palatine artery, levator palatine muscle and auditory tube? Structure passing through superior orbital fissure is cranial nerve 6th and lacrimal nerve. Arterial supply of facial nerve is ascending pharyngeal artery. Regarding the flow of cerebrospinal fluid, which one of the following sequences is correct? From lateral ventricle to third ventricle, then to aqueduct of Sylvius and then to fourth ventricle. The perilymph present in the scala vestibuli and scala tympani drains into the CSF through the aqueduct of cochlea. Superficial incision on posterior triangle of neck leads to difficulty in shrugging of shoulder. Which of the following transmits a nerve branch to the meninges? Foramen spinosum. The vertebral artery traverses all of the following except intervertebral foramen. So the vertebral artery traverses foramen magnum, subarachnoid space and foramen transversarium. All of the following statements about the vagus nerve are true except that it carries postganglionic parasympathetic fibers. So what is true about the vagus nerve? It supplies heart and lung, innervates right two-thirds of transverse colon and stimulates peristalsis and relaxes sphincters. All of the following are branches of the external carotid artery except anterior ethmoidal artery. So which are the branches of external carotid artery? Superior thyroid artery, occipital artery and posterior auricular artery. Paralysis of third, fourth and sixth nerve with involvement of ophthalmic division of fifth nerve localizes the lesion to cavernous sinus. The superior oblique muscle is supplied by fourth cranial nerve. The following statement concerning chorda tympani nerve are true except that it contain postganglionic parasympathetic fiber. So which statement about chorda tympani are true? Carries secretomotor fiber to submandibular gland, joins lingual nerve in infratemporal fossa and it is a branch of facial nerve. Sensory fibers from the taste bud in the hard and soft palate travel along facial nerve. The palatine tonsil receives its arterial supply from all of the following except sphenopalatine. So the palatine tonsil receives arterial supply from facial artery, ascending palatine and dorsal lingual. Which of the following is not a sign of stellate ganglion block? Exophthalmos is not a sign. So which are the signs? Meiosis, nasal congestion and conjunctival redness. True statement about parotid gland is a duct opens opposite to upper second molar tooth and it develops from ectoderm. Third cranial nerve supplies inferior oblique, medial rectus and superior rectus. Isthmus of thyroid gland lies again following tracheal ring, second and third tracheal ring. The following are branches of internal carotid artery except posterior cerebral artery. So which are the branches of internal carotid artery? Anterior cerebral artery, ophthalmic artery and middle cerebral artery. All of the following muscles are supplied by pharyngeal plexus except stylopharyngeus. So which muscles are supplied by pharyngeal plexus? Palatoglossus, salpingopharyngeus, and cricopharyngeus. Structure passing through anterior part of jugular foramen is inferior petrosal sinus. Superior orbital fissure includes third, fourth, fifth, and sixth cranial nerves. Angle of mandible is supplied by greater auricular nerve. The parasympathetic secretomotor supply to the nose is via Vidian nerve. Which muscle is an abductor to the vocal cord? Posterior cricoarytenoid. Which of the following laryngeal muscle is supplied by the external laryngeal nerve? Cricothyroid. The preganglionic parasympathetic fibers to the parotid gland travel in lesser petrosal nerve. Which of the following is not a branch of cavernous segment of internal carotid artery? Ophthalmic branch. Which of this part of vertebral canal will show secondary curves with concavity backward? Cervical. Exposure of left subclavian artery by supraclavicular approach does not require cutting of scalenus medius. It requires cutting of sternocleidomastoid, scalenus anterior, and omohyoid. Facial nerve stimulation during testing of nerve indicated by contraction of muscle orbicularis oris. Common carotid artery divides at the level of superior border of thyroid cartilage. All are in norma basilaris except mental foramen. So what is there in norma basilaris? Foramen magnum, foramen ovale, and foramen lacerum. All are features of unilateral third cranial nerve nuclear injury except bilateral ptosis. So what are the features of unilateral third cranial nerve nuclear injury? Ipsilateral pupillary dilatation, ipsilateral outward deviation, and unilateral ptosis. Central artery of retina is a branch of ophthalmic artery. The lymphatic drainage to central part of the lip is submental node. The maxillary nerve arises from the trigeminal ganglion in the middle cranial fossa. It passes forward in the lateral wall of the cavernous sinus and leaves the skull through which of the following foramen to enter the pterygopalatine fossa? Foramen rotundum. All the following structure lies outside the cavernous sinus except maxillary nerve. It lies inside the cavernous sinus. So which structures uh, lie outside the cavernous sinus? Sphenoidal air sinus, internal carotid artery, and foramen lacerum. Which muscle are supplied by facial nerve? Platysma, stylohyoid, and buccinator are supplied by facial nerve. Masseter and superior belly of omohyoid is not supplied by facial nerve. Which nerve supplies scalp? Zygomaticotemporal, greater occipital, and auriculotemporal. Medial wall of orbit is formed by body of sphenoid and frontal process of maxilla. Sensory supply of from external auditory meatus is auriculotemporal nerve. Adductor of vocal cord is cricothyroid, transverse arytenoids, and lateral cricoarytenoid. Intrinsic muscle of the tongue are derived from occipital somites. A young motorcyclist fall on the ground leads to creaks and lands. Which of the following nerves severance leads to cause of death? Vagus nerve. Submental lymph node drainage by all except floor of mouth. So submental lymph node drains anterior palate, tip of tongue, and lower lip. Which of the following nerve involved in opening inlet of larynx? Recurrent laryngeal nerve. Ligament of Barry in thyroid fixes cricoid cartilage.